Okay, welcome everyone. My name is Kevin Thomas, one of the managing members of Elevate Oral Care. Thank you for joining us tonight. Before we start, let me cover a few housekeeping items. For those of you remaining online past 50 minutes, your CE certificate will be emailed within hours of the completion of the talk. Be sure to check your spam folder. You're all muted, so don't worry about background noise. We'll have time at the end for questions. Submit questions on your webinar dashboard. They will be tracked throughout the talk for our speakers. Over the past 2 years, we've held a series of free live CE webinars on many prevention topics. Each of these webinars were recorded and are available with self-instruction CE at the web address you see on the screen. Bookmark this page and return often to see what's new in free CE. If you have a topic you'd like to see covered, feel free to suggest it by sending an email to info@elevateoralcare.com. Again, that's info@elevateoralcare.com. For tonight's talk, we have gathered 3 experts on the topic of teledentistry. You can review their impressive backgrounds on this slide, along with their disclosures. Their full bios are available in the handouts section of your GoToWebinar dashboard. It's called Presenter Bios. Per the title of tonight's presentation, we believe teledentistry can provide improved access to care for all oral health care settings. In the mid-2000s, I helped focus the Dental Trade Alliance Foundation on access to care funded initiatives when I served as their volunteer executive director. About that same time, I joined the board of the Children's Dental Health Project, an inside the DC Beltway organization started by Dr. Burton Edelstein. CDHP played an important role in gaining and expanding pediatric Medicaid benefits nationwide, a monumental access to care achievement. I currently serve on the American Academy of Pediatric Dentistry Foundation Board, a group that has supported $6.5 million in grants since 2010, helping grantees and supporters establish dental homes for over 573,000 children. After recent conversations with one of our speakers, Dr. Jackson, I was convinced that teledentistry can play an equally important role in expanding access to care for millions of Americans, not just the obvious teledentistry transformative areas like rural populations or mobile dental practices, but for every dental practice in the country, for your dental practice. Recent data from the ADA Health Policy Institute indicates that just 40% of the U.S. population visited a practitioner in 2017. In the early 2000s, one of the steepest declines in dental utilization was seen in the 19 to 49-year-old age group. This age cohort leans heavily on technology, a ripe and ready demographic for the teledentistry tools our panelists will discuss tonight. With that backdrop, Dr. Jackson, the floor is yours.
Thank you, and good evening, everybody. So the title is how can teledentistry impact my dental practice? So certainly serving the underserved and increasing access to care. It's kind of one of the reasons that I got into the business and our other co-founder, Richard Lee. But we have over the last 4 years really realized that the broader impact of teledentistry is going to be felt by everybody. Okay. They want me to share my webcam, so I will. So what we realized, you can go to the next slide, please. What we realized relatively early on, so we've been at this almost 5 years at this point, we realized early on is there really was a big misperception of what teledentistry is. And even today, you know, well into it, 4+ years into it, talking with people, the misperception is it's just a video. It's like what I'm doing right now, and I do it with a patient, and that's called teledentistry, big deal. So do I really need anything like that in my life if I'm just, I have my own practice and occasionally I can talk to a patient on the phone. Typically dentistry is hands-on, so I want the patient in the office, I want to talk to him face to face. But it is so much more, and if there's any one takeaway, there'll be several, but the one takeaway that I'd like you to remember at the end of the evening is how broad the communication capabilities of teledentistry are. And that's really what it is. It's a communication tool. Tele just means remote, dentistry meaning remote communications about dentistry. And you can go to the next slide, please. So we've got synchronous teledentistry, which just means real time. So when you're on the phone, you're doing synchronous teledentistry. If you're doing chat, synchronous teledentistry, video recordings, texting, anything that is happening on a real-time basis, that's synchronous. And these are all the tools that are available today, potentially even within one application. Okay, the next slide would be great. So, and then we have asynchronous. So if you send me an email, I don't read it till the next day. You send me a text, I don't read it till the next day, and so forth. So you can upload images, you can upload documents. I can do the same to you or to a patient, and we're all living in the asynchronous world in that component. So you can go to the next slide again. So really, what have we talked about here? We're talking about 7, 8 different communication tools that really weren't on the scene, let's say 5, 10 years ago. You've got the video conferencing, you've got you've got the ability to record something and then share it with somebody where they can review it in a secure setting sometimes later. You got chat, you got telephone, you got text, emails, and so on and so forth. And now, though, it's not just me and a patient. It's me and a team of people around that patient that can share that information within a secure setting. So with the patient in the middle in this particular diagram, there could be a dentist involved, a hygienist involved, potentially maybe a home healthcare worker that has a device that they want to be able to show you a picture on, or they want to get a real-time consultation with you about whether somebody in the senior home needs to go to an in-office treatment, et cetera, et cetera. Medical dental integration, I think you're going to see this concept coming into the fore fairly soon, meaning the next 5 years or so. So this is the ability to communicate across many people, all involving the patient at the center with many different tools. And so what is teledentistry as a technology solution? Well, it's got to be a technology solution that can solve what you're looking at right now. Maybe the dentist likes to use videos. Maybe the hygienist wants to use text. Maybe the patient likes doing chat. Maybe a healthcare worker likes to do video recordings. Well, there's got to be technology that keeps all of that straight. I mean, this potential boom in communication has to be kept in one location. Practice management systems really don't have the capability of doing that. So we look at teledentistry technology as sort of a layer on top of a practice management system. Multiple people communicating across a single platform, and with the history being kept, and with the patient being able to access all those communications. Yes, it can interact with the practice management system, but the practice management systems themselves can't interact. So there has to be that layer above. And so again, it is bringing all these communication tools together in a way that can help the patient and bring a team of professionals around that patient, where in a secure setting, PHI can be shared and potentially discussed. Maybe we have a video conference with 3 different people, including the patient, and so on. So once again, a major takeaway, teledentistry is a heck of a lot more than video conferencing between a dentist and a patient. It's a broad communication platform where several people are communicating simultaneously, and all of that's being gathered and shared communally. All right, Paul, I think that's a good intro. I think I can turn it over to you at this point.
Yeah, no, great. Thank you so much, Bill. And I will share my video at this point as well, so folks can see me. And I'm honored to be a part of this panel. I think you're going to hear several different viewpoints about teledentistry, what it is, and how it's contributing to the evolution in our world. Sort of the takeaway from me is it's contributing in a big way and continue to contribute in a big way to the oral health industry. I've been doing this now for getting close to 20 years since I first started doing some demonstration projects in it. So it's been a long time, and I've seen a lot of growth in the industry, some of which you're going to hear about tonight. So just to set the stage slightly, I think Kevin said it at the beginning, we have a world where an oral health industry that doesn't reach a lot of people. So if just based on data from the ADA Health Policy Institute, those people in our society who are getting full care, probably less than 100 million out of a $230 million person population. And if you look at people in certain groups, like people who are in minority groups, living in rural areas, people with disabilities, low income groups, it's even less than that, less than 70 million people. So what that tells me, it's a problem, but it's also a huge opportunity for an oral health industry that has potentially lots and lots and lots of customers out there that are not engaged with the industry fully now. Now, I look at this as not only something that's going to be changing dramatically and already is because of teledentistry instead of communication tools, but there's other things in place that are moving us in a different direction. Sort of design them in this Venn diagram, which is we're seeing changes in the way we even think about oral health, the way we pay for and measure oral health systems, our advances in prevention and behavior science. I think this webinar being sponsored by Elevate Oral Healthcare is an example of a company that's really on the forefront of prevention science. And then finally, delivery systems, which is where teledentistry hooks into all of this. So just a very quick word about the two circles on the bottom. In terms of measurement and payment systems, I think if you're not realizing it, it's important to understand that there are lots of people in the oral health industry that are very hard at work. Everything from the Dental Quality Alliance at the ADA to both public and private payers, to the HRSA Health Center system, to even group practices, looking at how do we start to change the way we measure things, the way we provide incentives, the way we actually shift from making rewards to just doing a lot of stuff to actually producing a healthy population. And even a step beyond that, it's not just people looking at how do we measure the impact of someone who walks through the door of the practice, but actually how do we measure the health and potential improvement in health in a community. And when I say this to dentists, a lot of dentists say, well, wait a minute, I can't do anything about the health of the community. People come into my office, I do what I can when they're sitting in my chair and they leave, and I don't have much ability to impact the health of the community. But I think that's actually changed. I think now with the advent of teledentistry and the kind of stuff we're going to hear tonight, we actually have a huge impact, a huge ability to impact the health of our communities. So we're going to talk more about that. The second point to just note is just a dramatic increase in prevention and behavior support science. And of course, we don't have time to spend much time on that, but just all of the new things from remineralization agents to buffering agents and caries arresting medication like silverdiamine, fluoride, and the ability to seal caries. It's not just that those are fabulous new tools in the dental profession, but these are all things that can be done by allied health professionals like a dental hygienist in a place outside of a dental office like a school or a nursing home or a community center that can keep people healthy without necessarily needing to make a trip into a dental office. And of course, all that gets realized when you start to think about a delivery system where you're actually connecting the office and the dentist and the allied personnel and the community. So of course, in the last couple of years, we've had a major detour in lots of aspects of our lives through COVID-19, but it actually has one silver lining, maybe several, but one is for tonight's topic is it's really increased the attention and the interest in teledentistry. So what I'm seeing evolving is just a lot of different ways that people are thinking about teledentistry. Initially, I'm going to skip it. Initially, people, I think it was more the idea of a patient would take a picture of a broken tooth and send it to the office, and then the dentist would maybe get on a phone call with them. Of course, that's still happening to some degree, but we're starting to see other kinds of things emerging, like the call center approach, where patients have an ability to get on a website and be able to interact with a dentist 24/7. Typically that results in some kind of referral back to an office, but it's a way that people can start to engage with the health system all the time without having to physically go to an office. We've seen the ability for much more seamless record sharing, and you'll hear more about that later on in this webinar tonight about networks of dentists and the ability to share records. Also, I think very exciting is a growing realization that it's possible through the use of teledentistry to begin to make office practice more efficient. So lots of realization now about the ability for a practice to begin to have interactions with patients before they come in for a visit, updating the health history, making sure that they understand what they're coming in for, filling out, just updating their demographic information afterwards, post-operative visits and other kinds of things. So it's possible just to make an office practice more efficient through use of teledentistry tools, just less PPE, less people walking in and out of the office. And so more and more practices are beginning to think about that. But what I think gets even more exciting is when you start to think about the potential for that office practice that now has sort of got the idea about how to use teledentistry tools to begin to engage the community. And so that can be done in many ways, including limited care, where maybe someone from the office, maybe some allied personnel are out in the community and they're doing screenings or some kind of early prevention and then referring people back to the office. Or maybe it's a full service system of care where this is actually turning things on their head. And the idea is they're trying to keep as many people healthy in the community as possible and only use the office for the things that are more complicated that need that office environment. Still, it's all one practice. It's all one delivery system. And I'll show you an example of that in just a moment. And then finally, what's I think a little bit newer on the horizon is what you're going to hear more about in the second half of this webinar is the idea of teledentistry care networks, where you have a lot of different people connected through teledentistry systems that are interacting with each other in ways that were just really impossible and unheard of previously. So all of this I begin to characterize as the idea we're moving towards what I call community engaged oral health systems, where it's not just the dental office over by itself and people kind of go in and out of the dental office where dental care happens, but it's a whole community engaged system where, of course, the office is a part of the system, but you also have care being rendered in Head Start centers and in nursing homes and in other kinds of community settings, all connected together through a robust, interconnected, record-kept teledentistry system. So I'm going to just go through one example quickly of a sort of full-service teledentistry system with care being rendered primarily in the community and the office being the place where people go for advanced surgical services. Many of you have heard about this, so I won't spend a lot of time on it, but we've called it the virtual dental home system, meaning we're producing all of the stuff that's typically thought about in a dental home, but it's happened through a community engaged telehealth connected team. So here's a picture of a dental hygienist and an assistant that are using portable equipment so they can be in one place one day and a different place the next day. They can be in, again, Head Start centers, preschools, schools, nursing homes, community centers, all kinds of places, collecting a full set of records like radiographs and photographs and everything you'd expect to see in a fully populated electronic record system that's collected by them and made available to a dentist in a cloud-based record-keeping system, so that the dentist who's not on site can actually get into that cloud-based record system and decide, is this someone who really needs to come into the dental office, or do I have enough information to make a diagnosis and treatment plan? And if so, what are the things that the hygienist or the team can do in the community, which turns out to be a lot of stuff. So example of a child in a school that doesn't necessarily need to make the trip to the dental office. Here's an application of silver diamine fluoride. Here's an application of an interim therapeutic restoration. This is no drilling, no anesthetic, just a scoop and fill technique using glass ionomer. That now the data is clear these things can last for many, many years. And so we did a demonstration of this whole concept across California in 13 communities and 50 sites over a 6-year process. And we're able to demonstrate that this is really something that can work. We can reach people who are not typically getting care, emphasize prevention, lower costs. It's really an extension of the dental office into the community, which was not previously possible. And in fact, the majority of people can be kept and verified healthy on site. In school children, we found about 2/3 of the children could have everything they needed to have done by the dental hygienist. Only about 1/3 needed to make a trip to the dental office. And that was before we had silver diamine fluoride. And now we're estimating 85%. If you think about that as low-income children who typically get no care until they have toothaches and end up in the emergency room, keeping 85% of them healthy in a school, it's just a huge game changer. Can't say enough about what a difference that can make. All done through a system of sort of continuous presence, the team being there all year long, not every day, and it really integrates dental care into a bunch of community structures and brings the dentist into a place where they don't have to be there physically. So just one quick example of how this can make a difference. There's many of them, but the common wisdom in oral health industry is that you really can't have a dental practice in this little rural community because it's just not enough of a patient base to make a difference, make a paying practice for a dentist. But if you start to think about having a member of the team be in this other little community that's 50 miles away or 30 or 60 miles away, maybe they're a day a week and another place a day a week, maybe a couple different team members that are in these other communities, and they're collecting records, the dentist is doing the exams, they're keeping a lot of people healthy. Some people need to go into the dental office to get some work done. Now you actually have a viable dental office in a site where you didn't have a viable dental practice before. So it's just one of many, many examples. I think it's also important to realize, as Dr. Jackson said, and I'm trying to emphasize, that there's no one way to do this. This is just a slide that shows various ways that providers can participate in a teledentistry system, everything from a occasional pre and post visit interaction to a full office-based system, to occasional community interactions, to a fully engaged community system like I just told you, and then being a part of a connected network, which you're going to hear more about. I refer to all of this stuff as community engaged oral health systems. And so what I want to just leave you with is the idea. I think this is a huge part of where the oral health industry is going. I think we look back 20 years and you ask people, do you use teledentistry as a part of the way dental care is delivered? And the answer is going to be, well, of course we do that. Why would we not do that? Not quite there yet, but we're getting there. And I think the pace of acceptance and understanding and adoption is accelerating. So with that, for hearing another perspective about teledentistry and its place in the oral health system, I'm going to turn it over to Bruce Silverman. So Bruce, this is over to you, and that's your first slide.
Great, thanks, Paul. Great information as usual. My role here today is teledentistry and dental carriers, kind of what's been going on, why are they, looking at teledentistry, and of course, where is it going? And I think as Dr. Jackson said, a few years back, teledentistry was really just all about access, but it's changed and it's become so much more. So at the start of COVID, something unusual and very rare happened across almost all dental carriers. They made a decision to cover teledentistry, many outside of the frequency limitations or maximums. There were no committees, which are usual, no long-term studies, no, we'll include this in your rate, but your rate, your rates may go up. And I was posting on a weekly basis on my website, bdsilverman.com, but I stopped doing it late in the summer because pretty much everyone decided to cover these visits as a DO140 or maybe a DO170, and I'm talking Aetna, Meritas, most of the Blues, including Anthem, Cigna, a lot of the Delta Dentals, Dominion, Guardian, and I can go on and on. And today, several carriers have continued to do that, but they've implemented now more formal teledentistry capabilities. I know Humana and Cigna are two, Carrington, various Deltas and Guardian, and through my consulting, I'm aware of many others that are in discussion or at least in the strategy phase of how we can implement this. Next slide, please. So the question ends up being is why? Why would carriers cover this and do this? And I think there's two reasons, which will be a little detailed, but why number one is look at who's paying the bills. You start with the employer groups, and you have to look at today's workforce. Right now, millennials, which are age 24 to 39, are making up about 44% of the workforce. Gen Zs, which are under age 23, they make up about 15% of the workforce. So you have 60% of those two groups making up today's workforce. And we all know that they live and die by their cell phones. If you look at Gen X, 40 to 55, again, many who use internet applications and cell phones, that's 27%. So 87% now of the workforce are using apps, they're using websites, and they're getting a lot of information there. That's just how they're used to doing business and their day-to-day chores and life. So the audience and their expectations have shifted. It's more realistic than ever to expect the benefits decision maker to be in one of these three groups, or the decision maker has to satisfy this new workforce, or they'll go somewhere else. You also have to look at the life experiences of the benefit administrator outside of dental. So questions are being asked, such as my medical plan has this, nurse practitioner hotlines, for example, work extremely well. Why doesn't dental? All of my wellness programs have virtual options. Isn't dental all about wellness and prevention? Or even outside of healthcare for a second, how many of you have ordered furniture online? I mean, I recently ordered something from Wayfair, and those instructions, oh my God. But guess what? They had a virtual option for me to connect and get clarifications. So for benefit decision makers, the thought of themselves or their members not being able to ask a dental question when he or she wants to doesn't reconcile with regular lifetime experiences and expectations. And those dental carriers, they have just learned if they are not addressing this, they won't be able to compete. In terms of paying the bills, let's look at the members, the groups or individuals. More than ever, benefits are extremely important when individuals are looking at career opportunities. Employers are becoming more and more demanding that their dental plan must demonstrate value. Today's insurers need to include telehealth in many lines of coverage for employers to attract and retain employees. So specific to dental, members and individual questions that are being asked are, I don't understand why you covered this during COVID, but not now. Why is teledentistry not covered? At my other job, it was. I can see my therapist under my medical program, but really, I cannot connect virtually with my dentist under the dental plan. In addition, more and more individuals are also asking if there's enough value in the dental program versus the cost. And for many, cost without convenience is just a showstopper. So again, some examples of what's going on today is the company has asked me to work at home, but why with the same equipment doesn't my company's dental plan allow me to connect with my dentist? I can schedule an appointment online for lab work and get an appointment confirmation immediately, but I have to call and leave a message for my dental appointment. My company monitors my productivity while I'm working from home, but for my kid's ortho visit, why do I have to travel 30 minutes each way and wait in the waiting room for a 5-minute visit, one that could have been done by video? Now that's really lost productivity. Next slide, please. So the second why really comes down to the almighty dollar, which for insurers shouldn't surprise anyone. Dental payers during COVID were making absurd amounts of money and profits, and clients knew it. They needed to do things that were beneficial to many. They gave, premium holidays, waived certain months of premium, made large donations for PPE and community donations and dentist loans. But they also started to cover teledentistry. Again, as I said before, without any maximums, without any deductibles, really just divert attention from the profits. Employer and customer expectations. Their dental plan, the dental carrier, as I said before, needs to deliver more value and demonstrated financial benefits, or they will shop elsewhere. So as an example, reduced absenteeism due to dental needs, especially in non-emergency situations. So if there's bleeding gums, the person doesn't have to come in just to say, you're brushing too hard or you're irritating them, do this or that. I've heard a lot about, and I'm sure you have, emergency room cost reduction. As the virtual model of teledentistry has proven to be successful, there's more willingness to add this low-cost capability to try to reduce the billions of dollars being spent each year on ER visits for dental issues. We've heard a little bit about medical dental integration, and there's more awareness today than ever before of the oral health overall health connection. Can additional interventions and prevention reduce more costly medical care? And reimbursement. And please don't shoot the messenger here, but carriers do see teledentistry creating a reduction in dental office admin and supply costs. No PPE, no sterilization, etc. And they believe this is going to translate into lower negotiated rates for certain services. I also believe new products are going to be offered because of teledentistry. I mean, we've already seen mobile dentistry added to many dental plans. It was extremely strong pre-COVID. Of course, it slowed down during COVID, but it'll become much stronger again later in 22 and definitely in 23. So teledentistry provides an opportunity for something new to sell. So expect to see products built around virtual capabilities. Perhaps on brick and mortar visits, the member would get one per year, but unlimited or near unlimited preventive virtual consults. Or perhaps an in-office visit followed by virtual preventive visits on a quarterly basis. And for that, the patient and dentist share in a reward, especially if they maintain their oral health. Or perhaps multi-line carriers providing medical plan discounts if certain defined services are performed virtually. So these are my thoughts of where products can go. There may be different versions of different concepts out there, but expect changes to occur in the dental products that the dental carriers offer. Next slide. So they also are extremely interested in this in teledentistry because of the collaboration capabilities that are available. And I'll start with Innetwork and in-network referrals, and why is it important to keep patients in network? First and foremost, again, it reduces costs for the patients, the employer, and the carrier. Second, dental must be no hassles. Business administrators are already dealing with issues on the medical side. They just want dental to go smoothly. Many dental carriers have their processing policies in place that their in-network dentists are required to follow. And it's just a no hassle administration for them. Also, no surprises. Really, these days, including legislation called the No Surprises Act, and it's happening all over healthcare, is there needs to be no surprises. You want to make sure they stay in network, no surprise balance billing, etc. Many are starting to use in-network, and they're rewarding their high scoring or high performing providers via teledentistry. So I know of one carrier that they look at their providers based on customer reviews, and they're steering patients to them either through triage or specialists are getting referrals because they're high performing providers. Once again, customer convenience and the customer experience. Through teledentistry, there's one set of forms, one set of photos, notes, communications, basically an electronic health record that can travel with the patient through teledentistry collaboration. Second opinions. Carriers can require this. We're all familiar with pre-estimates or pre-treatment estimates and predeterminations. When treatment plans get to a certain price point, carriers can require that these visits occur and get second opinions. Patients are looking at price or trust shopping. And what I mean by that is, as an expensive treatment plan, do I really need this much dentistry? Do I really have to pay that much? So getting a second opinion through a teledentistry appointment is definitely something that's coming. A lot of you have heard about dental artificial intelligence, AI. There are going to be programs that are going to recommend general dentists have a specialist consult, of course, on a case-by-case basis, but these can be done virtually, quick, convenient, and low cost. And it could be dental or medical. This is going to be an interesting one. Claims review or claims appeals. We know those are very labor intensive, manual, you wait a long time for decisions, etc. Envision there's a shared schedule from the dental consultants of insurers that treating dentists can go online, book an appointment, and have a teledentistry conversation with the insurance carrier. They're looking at the same diagnostics, they're talking about the case, and they come to resolution pretty quickly. It could even be done when the patient's in the chair. ER and urgent care, I won't go into that again, but continuity of care, in my opinion, is really provides the greatest potential to change the cost value curve. It stresses prevention, so ongoing patient follow-up. Patients can check in, on a quarterly basis with the hygienist to see that they're maintaining their oral health. Educational opportunities. The dentist can, provide a video to the patient and say, this is what's going to happen if your condition remains untreated. Well, please read this about your condition, especially because you're diabetic. Specialist referrals. Teledentistry is going to simplify the referral process tremendously. And there's a higher probability that the patient will actually go through with that referral if you can do everything from your office through teledentistry, including transferring the records and making the appointments. And it allows cross-discipline collaboration. So it focuses on the overall health of the patient, and especially when incentives are attached, such as through population health or value-based care. So really, in summary, from the insurance carrier's perspective, dental carriers have and will continue to embrace teledentistry as it meets the needs of a new, younger workforce. Employers and members are seeing virtual visits in many healthcare disciplines. They believe dental should do the same, or they will find someone who will. Insurers want to retain business. Employers are asking their dental carriers to demonstrate value, embrace more prevention, especially when other medical conditions may exist. There's an expectation that virtual care will reduce costs, whether on the dental or medical side. Employers are looking to attract new employees as well as retain employees longer. They're also looking to improve productivity by reducing unnecessary absenteeism or even personal time off. And lastly, carriers know the value of collaboration and what it can provide. Besides streamlining costly administrative processes, it can keep members in network, eliminating surprises, as well as enable continuity of care and ultimately produce healthier members. So thank you for your time, and I will now turn it back to Dr. Jackson.
Okay. Here. All right, here we go. So I'm going to fly through this last part, and it's really pretty heavy. So I'll ask your patience and try to follow. So if you think back to that slide I had where the patient was in the middle and all the other healthcare team surrounded it, and everybody's talking to everybody through a common electronic health record if you want. But again, it's all the communication tools that are being gathered into one place by that common health record. So how do you do that? I mean, how do you do that technically? So what's out there now is think of a LinkedIn in a secure setting that providers can belong to, and it isn't just limited to dentists. It could be hygienists, it could be other people. And when I say LinkedIn, it's a LinkedIn where you can invite others for free to participate into a network that you've created. If you're a specialist, maybe you want to create a study club. If you do work with home healthcare workers, you can create a network, with the hygienists and so on and so forth. So now we've got these groups, if you will, or I can just invite you and talk to you one-on-one. But I now have all these tools available to me in this teledentistry collaboration community that allows me to use video, to use chat, to use text, to do a video recording, et cetera, to be able to communicate with several people at a time if I want. So if it's a study club, it's a simple example, and I want to put up a certain case, it's PHI, so it needs to be in a secure setting. I can annotate it, I can put it up. Everybody that's in the group will be notified. They can go in and they can look. We could set up a video call. We could set up a video conference among several people, maybe even involving the patient. So here is this common tool then that everybody can be looking at. Again, it's not coming from your practice management system, but it can go to a physician. It can go to a nurse. It can go to a home healthcare worker or a senior home or an ER. So all of this communication happening, again, exploding, in my opinion. And so this is the way people can communicate. Now, one of the reasons that we wanted to bring in payers and bring in the public health aspect that Paul Glassman represents is here's an example of where that could be used. So let me use one example in the public health setting, and we do have some clients in the public health setting, so I'm pretty familiar with working with them. But these are entities that might be doing the virtual dental health, like Dr. Glassman pointed out. A hygienist going out into a community setting, or it might just be somebody who is doing risk assessments that's not a hygienist and gathering information. Well, some of those patients are going to have to end up going to a local dentist. So how do you get that information across? They've gathered the risk assessment, they've done the health history, they do have charting notes, they have certain information that they want to get across, but they want to be able to refer that patient to a local bricks and mortar office. Well, you create a group like I just described, and then somebody makes a referral to someone in that group. And so you search by location, and you find the dentist who is willing to take those in the public health setting. Maybe doing Medicaid. There's only a half a dozen people in the town that'll do it. Well, the 5, they're in that group. You find the one, and you send the information for the referral. And now all the data is there. The patient knows about it because the patient has a portal where they can learn what happened and if the referral was made, and they can see their records too. So that's one scenario of how it can work with public health. Now let's talk about the payer community. How can it work for the payer community? Well, in the case of, I'll use Humana as an example. They are utilizing a virtual care network of dentists that the network itself has dentists licensed in all 50 states. If a call comes in from Oregon, there'll be a dentist notified who is a Humana credentialed licensed provider in Oregon, can take the call, do a video conference, perhaps write a prescription, perhaps give other advice. But in the meantime, they'll have gathered all the forms, they will have taken notes, might have exchanged photos, certainly other documents could have been saved. After that appointment's over, now there is a way, continuity of care you've heard talked about a couple of different times. Now there's a way via the mechanism I just described to be able to refer that patient, who maybe the dentist in Oregon was in Salem, but the patient was in Ashland, Oregon, and 4 hours away. So they find an in-network dentist in Ashland. They make the referral. They send all the records. So patient now knows what office they're going to go to. The office who's receiving the referral then is able to see the records of the previous visit, and there's total continuity of care. This is something really, really important to payers, not only payers, but payers' clients too. So, in the past, and even in medical today, you take that virtual appointment and then you're on your own. Go see the physician. We think you need to see a physician, or we think you need to see a dentist. Good luck. And then the payer has no guarantee that it's going to an in-network provider at that point too. So here is another way. But then it goes beyond that. Now you're in these networks, you're receiving referrals, but perhaps you want to make referrals to a friend. Well, you can utilize the same tools. You just invite that friend specialist into your network, and at no cost, these people can refer. They can refer the patients, they can exchange records, and they can collaborate with each other. And that collaboration then can extend beyond. It can go into mentoring. It can go into any situation where collaboration, peer-to-peer collaboration, can be beneficial. And you can always bring the patient into it. And again, all of these tools that are available to you. So again, I think this is where you're going to see teledentistry go, and where it's going to affect the day-to-day practice in a way that's I don't think even I envisioned 5 years ago. And these tools are getting better and better by the day. So I think we've hit the time limits. I think we ought to go on to questions here.
Okay, thank you very much for your presentations, doctors. That was very informative and very helpful. I do have a collection of questions here that came in from the audience, and I'm going to start throwing them out to you guys. No particular order here. One of these I think was partially addressed, but I also think it's worth repeating here. One of the questions came in that I'll throw out to probably Dr. Jackson, and then anybody else who wants to answer as well. How can hygienists or even dental assistants implement teledentistry? And I think you touched on this topic already, so if you could repeat some of that information, it'd be great.
Well, I certainly can, but Dr. Glassman is the international expert on this, so I'll let him take it.
Well, no, thanks, Bill. I don't know about the international or or in the galaxy, but whatever. No, certainly there's a huge potential for us to begin to think about, as I use the phrase, telehealth connected teams. So in the example I showed you, that is dental hygienists and assistants who are actually in the community, interacting on a regular basis with community members in places that are outside of dental offices, and the potential to have a connection to a dentist who's not physically with them through a teledentistry system opens up a whole avenue of providing much more robust and much more full care than can be done if people are in separate delivery systems. So I think that there are just so many potentials here with just the number of people who are not getting care that can be reached, and there's just no way, even if every one of those 200 million people wanted to go to a dental office, there's just no way they could do it, but they don't. They face tremendous barriers. And so we're going to need, as we begin to develop these capacities, we're going to need dentists to be involved. We're going to need a lot more allied personnel to be the front end of these systems in the community. So I think there's just tons of potential for really all of the various players in the industry to have very active roles as this all develops and grows.
And as a follow-on to that, we do have a number of customers that are independent hygienists where that's legal. So they're using teledentistry in some of the ways that I just described. So they may not be affiliated with a dentist in states where they can practice independently, but they can use the referral system I described in a way that they can bring in other dentists in the community in case the patient needs to do an in-office treatment. But independent hygienists are definitely picking up, and there's a lot of interest there.
Okay, appreciate that answer. I think there's another question here, relatively related in topic here. In Ohio, a dentist must treatment plan a prophy before the hygienist can see the patient. So would teledentistry being used on a mobile dental unit count as an exam so a hygienist can complete a prophy in one visit to avoid bringing the child in or out of class for a cleaning?
Well, yeah, I'll jump in. I'm not sure what the Dental Practice Act is exactly on a state-by-state basis, and so that's a discussion locally. Does a teledentistry or a video conference with the dentist while the hygienist is out in the field, is that considered? That's a Dental Practice Act question. But there certainly are ways to, as I say, potentially have allied personnel doing risk assessments, and then letting the dentist evaluate the risk assessment. So there's probably more ways to get around it than not, but again, on a state-by-state basis, so the hygienist having a video conference with the dentist may suffice, but it may not too.
And I can just add something to that of course I totally agree that these has to do with state laws and that varies state to state, but there is increasing understanding and acceptance of the fact that a dentist can do a full and complete dental examination using a teledentistry system. There are many states now where that's actually codified in law or regulation. There's no question about it anymore. Other states, it's not so clear, but the American Dental Association came out 2 years ago with a teledentistry policy, and it is very clearly stated there that it's belief of the American Dental Association that dentists can perform an examination using teledentistry. And so that kind of increasing acceptance will be driving changes in states where it's currently not recognized as that being possible. More and more of those states are beginning to change those rules and regulations to allow the kind of scenario that you just asked about.
Okay, appreciate that and great answer. And that kind of leads into the next question. You mentioned the ADA putting out a recommendation that a dentist can do that through teledentistry. But the question that came in is for those of us in a beginning teledentistry, but our state doesn't have extensive regulations, rules, or coverage, what kind of words of wisdom can you provide to begin or for us to advocate for teledentistry?
Well, Paul, again, this is you.
Okay, well, yeah, there's lots of activity going on now about it. I have this map in my lectures that I show. I didn't show it tonight, but map of states that are adopting teledentistry policy, and starting in 2010, and more states getting filled in as you go through subsequent years, and the blocks of states are getting more, and the colors are getting darker, meaning more states are adopting policy, more comprehensive policies. So if you're in a state where you're not where you want to be, then I think the question included the right word, which is advocacy. And in today's society, you don't get those kind of things done by yourself. So it's really important, if you want to see an advance in teledentistry policy in your state, to figure out who else is interested. Many states have oral health coalitions that are very interested in seeing more access to care for people that they are concerned about. So get in touch with with those groups. There are often children's groups that are very willing to and actually have the expertise, and even lobbyists are willing to play a role in those kind of things. I was involved in a project, demonstration project in California that subsequently turned into a part of the law, and the turning into law was really driven almost entirely by several children's advocacy groups. So I didn't go knock on doors at the legislature. It wasn't my lobbyist, it was their lobbyists and their advocacy efforts that got the policy change. So, you know, I sometimes when I'm giving lectures about policy change, I shortcut it and say, well, you got to make some friends. And there's a lot of people who are very capable of driving those kinds of policy changes that are actually very interested in this issue and want to see more people have access to care and have it done in a lower cost and better way. So there's plenty of potential to get in touch with people in your state that can help with that kind of advocacy effort.
And I would add that the payer community is starting to push forward with this. It's extremely difficult. Let's take Humana as an example, to offer this nationally, but certain members in certain states can't get the benefit or can't get the the work done while others can, organize labor, stuff like that. So I think the receptivity of teledentistry itself is just changing, and I think you're going to see a lot of groups continue to push forward with this.
I just want to add, I think that's a really important point, Bruce. It's actually getting easier now, as much as it might seem difficult for someone in some states. It's getting easier, because when I first started doing this, I would start to raise this issue and people would say, "Tele what? What are you talking about? You can't do dentistry that way." And I don't hear that anymore. And so to be able to point to a lot of other states, no state wants to be last in terms of joining the modern world. So it's actually getting easier to have those kind of advocacy conversations.
Okay, great. The next question is about insurance coding, and this might be best for Dr. Silverman or perhaps Dr. Gates, but the question is, you mentioned D0140 and D0170. Do you have any information regarding third-party payments or reimbursements of teledentistry, and what other codes exist for teledentistry?
Okay, great. And I definitely skipped dental school, so unfortunately, we have two doctors on the call, but not myself. But thanks anyhow for the designation. But D0140, the limited evaluation, is the one that's being used most often. When claims are submitted, you need to add the 9995 code to say it was done by teledentistry. Insurers today are not differentiating payments, meaning you get more or less, for in-office or teledentistry. The other codes out there really don't apply. I know there's been some discussion on some others, but right now D0140 seems to be the code that's been accepted, by payers.
And that's a consultation code, I should just add to it. So you let the insurance company know that it was teledentistry, and then you bill for the 0140, which is the consultation appointment.
And I just want to add to that I think what you just described, Bruce, is the baseline, sort of the general thing that's been accepted in many payers. Mm-hmm. But there are states where they do cover a lot more things. For example, in California, turned out that our Medicaid system kind of led the way, because they were the early adopters based on a law. They were kind of forced to do it, but early adopters, and they will pay for just about anything you can do using teledentistry. You can get paid for. So if you did an examination, a full or limited examination or periodic examination, if x-rays were taken in the field and reviewed by a dentist over here, all those kind of things that can be done that way, they're all covered regardless of whether you did them in person or not. Hopefully that's the way more and more carriers are going to be thinking, but again, there is a variety, but there are some that it's actually pretty extensive.
All right, thank you very much for that. Next question comes in. This is probably Dr. Silverman. I know you mentioned the No Surprises Act. Is that federal, and is it in all states, or can you provide some more information regarding that act?
I can provide a link after this, which you can send out. It's federal legislation that's being enacted that basically, and it's on the medical side, but it will apply to dental. And it emanated from folks going to the hospital and getting large anesthesiologist bills, or seeing other practitioners that weren't in network. But I will definitely, I'll get the source of that and send it out.
Okay, appreciate that. And then Dr. Jackson, I know you made mention of connecting different offices as far as referral networks and various things like that. But one of the questions came in somewhat related that said they were questioning dental and medical integration. Are there any applications that integrate medical and dental referrals and communication between the two branches, and anything that communicates with home health care?
Kind of. There's one really, really big, expensive solution that's really only realistic for large organizations, and it's a large medical application called Epic, and they've worked with Pacific Dental Services, a large DSO out of California, to create a medical or a dental module called Wisdom. So the Wisdom Epic is one complete application. It's not practical for anybody that's, it's for 99% of the entities, and it's really not even practical unless you're co-located. If you have multiple hospitals and multiple locations and multiple dental offices and multiple locations, very, very difficult and very expensive. Other than that, there really isn't, other than what I just described earlier, and that is the solution, the teledentistry solution, that allows everybody to share across multiple applications. So this is a discussion that's kind of ongoing with physicians. What do they really need to see in a dental chart? In the dentists, what do they really need to see out of a physician's chart? Does it really have to be fully integrated into a practice management application? Is that even possible? So again, this is a conversation that's kind of ongoing at a technical level, but there's going to be both solutions, and we don't see anybody in the near future that's got other than the Epic Wisdom. And again, you're talking millions of dollars there. That's the only solution on the market right now.
All right, thank you very much. Two more questions actually, and I think we'll wrap it up here. One of them is kind of a direct question. Can you just use FaceTime or Zoom, or do you need a more formal platform?
The one I hear every day. Yeah, well, you can, as long as the HIPAA people don't pay any attention to what you're doing. There is a Zoom Professional, which is a little bit more pricey, that does offer a HIPAA secure setting. But you lose. So what don't you do if you're using? What do you lose if you're just doing that? Well, you lose the collaboration capability. You lose the ability to share records. You lose the ability to gather information from the patient regarding, forms. And some of those are, their consent to have a teledentistry appointment is a requirement. So you don't have the ability to do the forms. You're not putting it into any legal record unless after you hang up, you remember what you said and you run over to your practice management system and put it in there. You lose the capability of ongoing communication with the patient. Do you want to send them certain materials? You lose the capability of communicating with other providers.
Yeah, excellent. And the last question that we'll put out today is a general dental office. How would you suggest that we begin? What tools, what patient services, or what general appointment types, if we were to choose one, how could we begin doing teledentistry?
Well, there's a number of ways, and it's a really good question because there's teledentistry tools out there that can be really complicated and almost overwhelming. So finding something that's very specific, the easiest I think is using it as a case presentation tool, like Dr. Glassman talked about before. So maybe the patient comes into the office that day, you or whoever didn't have a chance to spend any time with them. Well, you can get back on and talk with them later on, perhaps even in the evening. Another tool that has gotten really popular is a video recording. So maybe the first appointment, let me just take one off the wall. The first appointment is for an expensive implant consultation. Well, the patient might not know what the actual cost is going to be. So the actual cost is going to be maybe in the tens of thousands or 6,000 or 7,000, whatever. The patient's thinking in the hundreds. Well, don't bring them into the office for that first appointment when in fact, just get to know me. I get to know you. Let's talk about your case. Maybe I'll ask you to send me some photos. And then, you know, I'll talk about it later, and I can give you a price estimate later. Well, then later on, at my convenience, I can do a short video, maybe a 1.5-minute video, where I just say, you know, you're a great candidate for this particular kind of treatment. Let me put together a price estimate of what this would be. I'll also share with you a video that is about what this looks like and some before and after photos. I'll tie that into it too. And you can even accept on you know, through a video appointment. But what you know that once they've come into the office, you've got a patient, because they know they're an informed consumer at that point. So that's another way that people are that they're using it a lot. Using it for marketing, to let you know, people in their local neighborhood know that there is the ability to have a scheduled appointment for a video conference. So, you know, and I can go on forever, but I think those are probably the top ones.
And I can just add just something to that, Bill, which is I think what I've seen over the last 4 or 5 years, and particularly accelerated during the pandemic as it began to close offices and people were struggling getting to dental appointments, was a lot of general dental offices thinking, okay, I got to do this teledentistry thing. And it really goes back to the previous question about just using Zoom or something like that. And a lot of dentists would say, okay, I don't want to get too far into this whole thing. Let me just get a subscription to the more, you know, the professional Zoom or this other kinds of equivalent things. And then I'll get another prescription. I want to collect some money. So I'll collect the money using something else, and kind of I'll use the word kludging together various pieces. My advice now to someone who's beginning to think about this is start with the real teledentistry system, one that has all the capacity built in, like Dr. Jackson just said. Even if you don't use all of it at the beginning, even if you're just using it to shorten the first visit where you're collecting health history and demographics and some other kind of information, or just talking to the patient to set expectations, or just doing an occasional post-op, having all that stuff in one record system where it all is sort of seamlessly integrated, the patient can get access to the records, and then you start to grow what you use it for, but you don't then start to have to switch to a whole nother system. Starting with a system where all the pieces are together really is the thing that would make most sense to me. And these things are not that expensive now. They really pay for themselves. Really, actually, just a couple of visits in a month, and you've paid for the cost of a fully integrated system. So that'd be my advice to someone getting their feet wet in general dental practice.
All right, I
Thank you
appreciate.
to our presenters. Back to me, Steve.
Yes, sir.
Well, thank you to our presenters for a great presentation, and thank you all for joining. To our guests, your CE certificate will be emailed automatically within an hour or two. Make sure you check your spam folder. Be sure to follow us on Facebook and Instagram for links to new free CE events. The link you see on screen gives you access to our archived webinars, including our panel discussion tonight, which should be accessible before the end of the week. Please share this link with your staff and colleagues. Finally, on our Elevator Oral Care website, you'll find buttons to request an informative CE-eligible staff meeting. Education on the latest evidence in oral health prevention is what we do. Our team is eager to help your offices expand your preventive programs. Dr. Jackson, Dr. Glassman, and Bruce, thank you very much. And to our guests, thank you, stay safe, and have a wonderful rest of the week.
Thank you.
Thank you.